Here's why your current anxiety coping skills and strategies might be letting you down. The latest research into anxiety treatment is showing us that there are multiple layers of anxiety which most therapists aren't really talking about because it's so new. So here's the latest thinking about what happens with anxiety. First of all, when we get faced with some uncertain event, a situation that makes us anxious, something that triggers our anxiety, we make a threat estimation. Our brains look at how dangerous this event is, how much risk there is, and then we start creating mental images or creating movies, usually about worst case scenarios, what could happen, what might happen. And depending on the nature of these stories that we tell ourselves and how gruesome they are, we will generate a huge amount of agitation in ourselves, lots of anxiety feelings. And the more gory, the more disastrous these mental images are, the more anxious we feel. If you can catch yourself doing that and realize that you're making yourself anxious with the stories you're creating, that is fantastic. You are catching the trash talk. You're basically realizing that you're telling yourself stories about things that may or may not come true and probably won't. But what if you still feel anxious? What is going on then? Well, there is a whole other layer to anxiety, and it's all to do with uncertainty. Some of us have a very high need for things to not be uncertain. We call that a high need for predictability and a low tolerance for uncertainty. When that is the case, what that means is even if you are catching the fact that you're making up stories about imagined events, we still haven't eliminated the fact that there's something uncertain on the horizon. You don't know how the call with your boss is going to go. You don't know what the date's going to be like. So if you have a low tolerance for uncertainty and a high need for predictability, well, guess what? You get a whole nother layer of agitated feelings, anxious thoughts, racing heart, sweaty palms, you name it. If you've got a low tolerance for uncertainty and a high need for predictability, you're probably going to start engaging in your safety behaviors. You can worry, you can ruminate, you can be stewing in your thoughts, which is my personal preference when I'm anxious, or you can engage in more active safety-seeking behaviors. This is anything from asking other people for assurance, or you could be checking things repeatedly just to make sure, or you can overly plan, overly organize. You could do a lot of research to find more information to make sure that you have eliminated all uncertainty. Or you could just avoid the whole thing, which is the ultimate safety behavior. You're not at any risk if you don't show up. But the problem with all of these safety behaviors, especially with avoidance, is that we get some instant relief from them, but there's no long-term impact. The relief that you get from just saying no to the party or looking for a new job is very seductive because your anxiety will tell you that it's because you said no that you feel better. And that's reinforcing the behavior. Anxiety will tell you then that you should say no to everything. More importantly, these safety behaviors don't tackle the fact that you have a high need for predictability. When facing uncertainty, we're effectively just putting a band-aid on things. It's a bit like treating a sore throat with ice cream. It feels good in the moment, but it's not the antibiotics that you really need. When we lean too much on our safety behaviors, we never actually learn to tolerate or grow our capacity to handle uncertainty, and we never get to confront the demand that our brains have for everything to be predictable in a very unpredictable world. So when the next situation arises, we haven't grown at all. We haven't adjusted our expectations or our capacity to handle uncertainty. So the next threat assessment remains high, if not higher than it was last time. And then we are stuck in the same loop and the spiral continues. My approach to anxiety treatment here in Los Angeles is geared towards this core issue that a lot of anxiety treatment programs and therapists are missing because this research is relatively new. So if you're curious about anxiety therapy and you live in LA or California for that matter, check out the website, take the free anxiety quiz, find out more about my approach and the way that we think, and get in touch if you're interested.